Hey, Annie.
Hi, Dr. White.
So
I'm
we
out
did
of the picture already.
So we rolled out that or tried that process about a week ago, 10 days ago.
Yes, we did.
And I just wanted to talk through with you about things that you thought were pros and cons
Okay.
of what happened. And specifically, I want to try to address elephants in the room, things that you think will be problems that the nurses will have
Okay.
with what happened. So the main gist of the whole process is to move the providers from the back to the front.
Mm-hmm.
And therefore the providers can contact patients earlier, and if they see them earlier they can put orders in earlier. The other part of it is then the nursing side knows what's going on. From my perspective, I thought one of the issues that came up that was problematic was communication between the front and the back.
Yeah, that was going to be my first suggestion as well.
And we talked about a few solutions. I know one of the things, you already got the EMS radios up front.
Yes, we've relocated the radios. The nurses are carrying handheld phones now. We're going to make sure the providers are doing that as well. But that doesn't really give that immediate communication. There's still a delay when you're dealing with a handheld phone. You have to call the right extension. Hopefully somebody picks it up. So we've toggled with the idea of doing some type of like earpiece radio. We're going to get some feedback from the nurses and see. With that, some of the barriers I anticipate are just the overwhelming sense of the nurses are already carrying this radio, that radio, now a phone, now another radio. Is that really the best option? But we're open to trialing some things to improve that communication for sure.
I think it'd be nice if we could localize it down.
Yeah.
Now the phone you're talking about has the ability to do a walkie-talkie as well.
It does. We're trialing that. Currently, I think they only use it to like notify the department that we have an EMS inbound. But I've noticed, at least from hearing it from the background, is that it's not as, the communication's kind of broken up. It's not as crisp and clear as you want it to be. And you can't dictate who hears it. Anybody that is carrying that phone will
Sure.
get that communication. So then you have some issues with how compliant are we going to be and make sure that we're utilizing it appropriately.
Well, is IT involved with the communications to make it better so it sounds better?
Yes, we're working through, is it like a Wi-Fi connectivity issue? Is it a phone like just tech issue? We're gonna have to drill down on that a bit to see. Or is it just a user error? Are we not pushing the button correctly, speaking too soon before it's ready to connect? Just
Okay.
kind of drilling down on what some of those barriers could be.
So yeah, I saw that as communications was a big issue. The other part is just an understanding, at least from my perspective, of how to flow patients. I think, at least I felt like the triage nurse often felt like she was on an island by herself.
Yes.
And that I saw the triage nurses doing what nurses try to do, which is they were trying to do everything they could to deliver care, but then they ended up overextending themselves, and then triage got lost in the mix there. So a couple of the things that we kind of threw around as ideas is, whenever there's a provider, there's a paired triage nurse with them.
Correct.
And then a tech there right behind there to be able to draw the specimens when that comes out. I want to reassure the triage nurses that when we've done this at other places, they don't get overrun. And if it's managed correctly, the providers should be engaged in helping to offload them from what they're doing. Do you have any thoughts on that?
Yeah, no, I think that's great. I think there's something to be said about, it was a new process and kind of working out the kinks in the front. It's going to require some education back to the nurses and some empowerment for the triage nurses and the charge nurses together to realize it's their ship. They navigate, you're just there to provide care, but they should be in control of where these patients are going, how these patients are flowing through the department, and knowing that triage has to be the priority. Triage still has to be the focus, and then we've always got to have somebody in triage partnered with you there. So there's some staffing models that we're looking at, and kind of giving that back to the charge nurses to think to kind of pick their brains on what their ideas for that could look like. And I think we've come up with some pretty good solutions to have a secondary nurse out there. Obviously, we'll have to play with our staffing metrics a little bit to support that, but I think we'll get there.
Okay. And one of the things that's a little bit of a shift, and a lot of this is different as you do it, but when the patient gets to the back, in theory, they should have their blood drawn and sent. They should have their IV placed. Hopefully a urine would be off. And the nurse in the backside would be more responsible for passing meds and reassessing the patient.
Right.
And hopefully that would help offload them from the other duties since they would be done up front.
Right. and that's a shift a little bit from what they're used to. Ideally, the patient, you kind of go back to the previous model, which was nobody sits in the waiting room, you direct bed a patient, put a lot of pressure on that primary nurse. Everything from the moment they arrived until they left was on the primary nurse. So I'm excited about kind of shifting that work dynamic and that flow of really being able to utilize everybody to their potential in the role that they're supposed to be. What's triage function is going to be, what's that secondary nurse's function of the IV, and then them realizing when they get to the back how much lighter their load appears to be. If they have a patient that comes to their room that already has an IV, has already collected the lab, the urine's already been collected, and realizing from there they can spend a little bit more time with their patient and their assessment and providing those medications. And whereas before it's just a constant rush to the next task, they'll be able to kind of step back a little bit and provide patient care without the stress of too much tasky stuff.
Well, and one of the hopes is to have the charge nurse oversee and get the patient where the resources are. But the other part is, and I think this was somewhat missed, and I probably didn't communicate clearly enough, is the triage nurse is really in charge of triage. And the providers are there to contact the patient. Personally, I think anything that stops contact between the patient and the provider is delay in care, because the sooner they can contact, everything else can happen. But that triage nurse needs to be in charge of what's going on, because they know what their capabilities are, and they have to communicate with the back to ensure the flow. Continues.
And that's one of the things I think I'm most excited about with this is getting triage back to what triage was designed to be, and really empowering my charge nurses too, and getting them back to being in control of their shift, in control of the patient flow, really having that comprehensive look at everything from every position, instead of being stuck at a desk doing desk work and not really getting to know what's going on in the front. I'm really excited about that potential.
And the other big thing that came up from the provider side was HIPAA and patient confidentiality. And I know we talked about positioning some of the monitors or and screen protectors to prevent that. And another item I brought up to the docs, and this goes back to carrying a cell phone, is the ability to make calls on that and moving out of that area when you're having a sensitive call. But that's something that obviously you got to be attuned to. With what we're doing up there, both with nurses.
I think that's definitely something that we'll have to keep in our forefront and focus and work through that process. But it's good to hear that you're sharing that with the providers of what that would look like from your standpoint to maintain that.
Sure. All right, well, let's pause that one.